dissection is one of the most common acute aortic syndromes, and it's one of the most lethal of all the classification of acute aortic syndromes. Aortic dissection occurs when there is a tear in the intima, which is the inner layer of the aorta. The aorta is comprised by three layers. The one is the intima, the other one is the media, and the external layer is the adventitia. So when we have a tear in the intima, there is a blood flow. Free blood flow goes longitudinally in antegrade fashion or retrograde between the intima and the media. So there is a formation of the true and false lumen, and that can lead to detrimental effects for the patient. We have a variety of classifications regarding the aortic dissection. One of them is the Begge classification, which mentions that if you have a dissection anywhere in the aorta, as well as in the ascending aorta, then it's the Begge classification type 1. If you have type 2, the Begge classification, that means that the dissection of aorta is confined only to the ascending aorta. The type 3A classification involves solely the descending aorta. So we have dissection of aorta, only the descending aorta. And the type 3B dissection means that we have dissection in the descending aorta as well as below the diaphragm. We also have the Stanford A classification, which is the type A, which we have involvement of the ascending aorta, and we might have involvement of all the parts of the aorta, which comes in great contrast with the type B classification, which you can have the dissection almost everywhere besides the ascending part of the aorta. So if you don't have dissection on the ascending part, it's type B, Stanford classification. The dissection of aorta can have detrimental effects for the patient, such as cardiac tamponade, cardiac ischemia, acute stroke, and malperfusion syndrome. The malperfusion is actually when we have less blood flow to the end organs, which that can lead to the end organ ischemia. We have a timeline zone of how to define the classification of the onset of dissection. So hyperacute dissection of aorta is when the symptoms start less than 24 hours. We have the acute dissection of aorta, which that means that it's between 1 and 14 days. The subacute dissection lasts between 15 days and 90 days, and the chronic dissection is more 90 days and more. So that's the chronic type.